Okay, thank you. So Natalie, please start.
So thank you, welcome all. I'm Natalie. I was part of the Indio Media exchange program in 2017, and Petra, she's our technician today. She also was part of the exchange program. Welcome to the third webinar reporting on the climate crisis. If you like the session, stay tuned. There will be 2 more to follow. And it was supported by the Bush Alumni Network. So today we have a special focus, and it's on climate change and health, which is really a topic often neglected. And so we have a focus on, we have invited 2 experts in this field from a different perspective, one health journalist and also advisor, and one visual journalist, and they have both their different approaches and their different experiences. So we welcome Martina Merten from Germany and Fabia Mohir from Dhaka. So should we make a short mini-meter?
Yeah.
For the start?
Yeah, sure.
Because we are also curious about our audience.
So we have a small survey. I will share the link in the chat, and you can now follow this chat by opening the link, and then you can have a small survey. I can share the screen so you can all see what is live happening. So let's see, are you seeing this? So we have this question, have you already reported about health or climate related issues? And you have 4 answering options, and you can now, if you want, vote live. So
this gives us also a little bit for the discussion to see how in deep we can go or not, or for example, how in deep Martina and Fabia can go. So if you have a little bit an overview.
So now I will presentation sharing. Now we have the result of the first. I will again share the screen. So, oh, that's an interesting, there was no climate change reporting. 0.
Maybe just in the combination, because I think everybody who's staying in Asia would have once or the other time reported there was a cyclone, for example. There are heavy monsoon rains.
So if you want, we have more slides, 2 more.
Should we make it now or should we
go can on? Do later, okay, no problem. Yeah.
All right, so first we get a little introduction from Martina Merten, and we are lucky that she just trained some journalists how to report on health. So she gives us a little introduction into her work and also what she can give us on the way for the people who have not reported so much on it and one or the other link. But we keep it a bit brief. And yeah, since 2014, she's reporting on global health and also on climate change. And she worked in China, in Pakistan, in India, and in African countries and the Philippines. And afterwards, Fabia will give us an introduction in her work.
Yeah, hello. Glad to join today's seminar, and very glad to be invited. Yeah, I've been reporting on health issues for nearly 20 years now. I've started in 2002, and I started to focus on international health issues in 2005 by traveling to all kinds of countries. And the mere focus on global health issues and topics started in 2009. So that was basically the time when my passion for global health reporting started. I'm also working as a global health lecturer and consultant on the side, which has started some years ago. And recently I also got in touch with climate change in health, because this is one of the global health topics which will be very important in the future and which we as global health reporting journalists cannot avoid anymore. I have also reported being supported by the European Journalism Center. That's where I, what I just learned, met Julia and Petra, which was in India in the year 2017 on aging populations, and 1 year later in Pakistan on genetic disorders. And just recently, some months ago, when we were still able to work on the ground, I worked in the Philippines, one country which is very much affected by climate change and health. And it might be of interest to some of you that when I was applying for the Global Health Reporting Grant, I actually applied with a topic which had to do with climate change and health in the Philippines. But interestingly, people were not too much interested in that topic. So while applying, I changed this topic from climate change and health to exploitation of children, sexual exploitation of children, which I really found a pity, because to me, climate change and health is a topic which we all have to cover in the next years. It's really a pressing global health topic. I have organized all kinds of press trips for journalists to Asia several times, to India and also to the Philippines on behalf of Journalists Network. And recently I taught Asian journalists, master students, on how to seriously cover COVID-19 in crisis situations. And unfortunately, I had to learn that many of them actually lost their job because of the pandemic. So that was really sad news to me, because they were all very ambitious and came from all kinds of different countries, India, Philippines, Bangladesh, Malaysia, and so on and so forth. Well, I will briefly touch on climate change and health and give you some numbers which are related to the topic, because I don't know if you ever heard about those numbers or what numbers might be of interest to you. Last year, I gave a seminar at the Charité University Berlin, where I also teach occasionally. And I taught alumni Charité students on the effects of climate change on health. Just some basic backgrounds, but yeah. So I will share some of my slides which are related to that topic. Hopefully you can see those. Can you? Okay. So I just want to present some numbers so that we better understand which are the effects of climate change on health for the people. So there is the estimation of WHO that climate change is expected to cause approximately 250,000 additional deaths per year, and that will be between the year 2030 and 2050 from, for example, malnutrition, malaria, diarrhea, and heat stress. And unfortunately, those countries are most affected which are least developed, and this is something which you might know already. There are always estimations about how much money will be lost due to this development, and the World Bank estimates that it will be between 2 and 4 billion per year lost by the causes of climate change. Well, and if we look specifically at health effects of heat, for example, and heat is one of the causes of climate change, we can say that high air temperature, for example, contributes to death from cardiovascular and respiratory diseases, especially with elderly people. And we know that our worldwide population is aging. And just to give you a number, in the heat summer in the year 2003 in Europe, more than 70,000 excess deaths were recorded because of heat. There are other causes, health effects of heat mentioned here. The level of pollen, for example, is rising, and high temperatures raise the ozone levels, and so on and so forth. But there are also health effects because of natural disasters. Natural disasters are going on in many countries, like Philippines, like Bangladesh, like Vietnam. And if you look at weather-related natural disasters, they resulted in over 60,000 deaths every year, mainly, and that's what I said already, in developing countries. What is also not known to many people, that because of these natural disasters, people are losing their homes, they're losing their securities, and this in the end results in mental disorders, which are already affecting many poor people worldwide. And also increased rainfalls have affected the supply of fresh water, and lack of fresh water increases the risk of diarrheal disease and many other things. You might have heard that infection patterns are changing. We have more dengue cases, we have more malaria cases because of climate change, and the transmission seasons are becoming longer because of climate change, which is also a very serious issue. So just to summarize this, and you might have heard these numbers already, but now just to look at them, I said additional 250,000 deaths per year will be being caused through climate change. And here you can see the numbers broken down. 38,000 deaths due to heat exposure, 48,000 due to diarrhea, 60,000 due to malaria, and 95,000 due to childhood undernutrition. So these are just some background numbers and information which I wanted to give to you at the very beginning here of this discussion, and I hope I didn't exceed my given 5 minutes, and I stop here and hand over the floor, I guess, to Fabia to learn more from your point of view as a photographer.
Thank you so much, Martina. This is really insightful. I'm very glad to be here, and I would like to first screen share my presentation. Just give me a moment, please. Yeah. Okay. For some reason, it's not working. Okay. So first, I want to introduce myself. So I'm a visual journalist based in Bangladesh. I use still images, text, and video to produce multifaceted storytelling for editorial and nonprofit clients. I use intimate and involved storytelling approach to communicate meaningfully about the human experience. As a humanist photographer, I tell people-focused stories that explore the themes of social development, migration, gender violence, and forced exile in the marginalized communities. It's been 10 years I'm working as a journalist, and more than 4 years now I'm working as a photographer. I'm a passionate believer and practitioner of ethical storytelling. What drives my work is the potential for storytelling to bring change and initiate dialogue. The girl that you are watching is like saying at this moment is a nomad girl. So as you can see, she is also you can say survivor of climate change, because the community no longer can move as like they used to move before. And their profession is now in danger, and the community itself is now in danger. So my main focus remains to tell the stories of a vulnerable population who are directly impacted by climate change. I believe that, like many of other photojournalists, that photography can change the world. I often ask myself how my stories can drive change. Visual journalists play an important role providing vital information to communities affected by crisis. We have to continue to question how we tell these stories, make an impact, and minimize risk, both for ourselves and our subjects. This image was taken in the Rohingya camp during the peak hours of COVID-19. And we continue to ask the world to wake up. My work focuses to create impact, to influence not only private individuals, but decision makers and whole communities. And showing the injustice provokes a mental shift and subsequent action from people who do have the power to incite change. This couple was underwater for almost 1 week, and they are trying to dry their clothes. So I was covering the news of flood, and I was in Gaibandha, is one of the coastal region of Bangladesh. So why it is important to bring these personal stories, because these farmers who are losing their land and their homes every year. I mean, this couple has lost their homes 20 times till now, and every month every month they are both together visiting their old home in a hope that their island will rise, but that never happened. So as Martina was explaining that the damage, the psychological damage and the trauma they are also bearing, it's actually no data can provide or we can emphasize enough to explain their situation. And they are in the forefront of climate change, but they are little contributing to this climate change. So reporting on climate change, Bangladesh loses an estimated of 100 square kilometer of land to river erosion every year. Cyclone, storm, flooding were always a part of life, but now come more often, are less predictable and more powerful. I have been reporting on climate crisis and gained a deeper understanding of the potential role of climate change and its effects on human health-seeking behavior. The lady you're watching has removed her uterus. It is a connection between the salinity of the water that the women in the coastal region are facing more often. They are not sure why it is happening, but every year it is increasing. If you get to see the data in the health clinic facilities or to the doctors, that more and more female are facing different diseases connected to their like they're having cysts, and many of them are advised to remove their uterus because they do not have healthcare facilities available in the island as well. And it is their health crisis situation is linked to climate change and the salinity of the water, because you can see water everywhere, but they cannot drink even a glass of water. That's the irony of this scenario. And how it is affecting Bangladesh. Bangladesh is one among the other countries of the world experiencing the most severe impact of climate change. The Global Climate Risk Index 2017 ranked Bangladesh among the top 10 countries most affected from 1996 to 2015 based on the long-term climate risk index. The world's 7th most populous country, Bangladesh is the highly vulnerable to climate change due to both geographic and human factors. It is prone to cyclones, drought, floods, storms, high salinity, especially in coastal region. Imagine Bangladesh in the year 2050, when its population will likely have zoomed to 20 million and a good chunk of its current land mass could be permanently underwater. But Bangladesh don't have to wait decades for a preview of a future transformed by rising seas. From our vantage point on the Bay of Bengal, we are already facing it. Collaboration. I strongly believe that the first step to changing injustice in today's society is to collaboratively imagine with disadvantaged communities what a more just future could look like when visualize that new reality through storytelling, so that others, especially those who have the power to change society, can be exposed to new perspective on where things still need to change. Some images while I was covering natural disaster. From my part of the world, only a very few number of female photojournalists are covering COVID-19. Within my community, as a female visual journalist, I have immense access to the lives of women. Violence against women has increased. Homeless women and children are in greater danger. Transgender, sex worker, and the refugee communities are suffering from the crisis. And I cannot emphasize enough on the topic that climate change has pushed women and girls in the coastal belt in a severe manner, because now at this moment when the pandemic is happening, they do not have food at home. And many of them are willingly leaving home, escaping from poverty and sending themselves to the traffickers, which is of course affecting the family and the community itself. And child marriage, now it's at its peak. Like Bangladesh is already, last year it was number 4th in the world in considering the child marriage number. But now we do not know what will happen, because it is visible that parents parents are giving up their daughters and counting their son in this situation. Diverse and cross-border reporting. As I say, that only 50% of photojournalists are women. Female visual journalists are still struggling to reach proportional number of representation in the industry. There is a major diversity problem in the news industry. If we want to document people and places with nuisance and sensitivity, we need to be doing it as a diverse community of storytellers. I believe cross-border reporting is a great initiative to build that bridge, to bring equality and producing impact-driven stories. Thank you so much, and I'd like to discuss more with all of you.
Thank you both, Martina and Fabea. You both brought up some questions or already mentioned some topics where we can have a discussion on. So first I would start with one question, and then of course the audience feel free to send questions that we can talk about it. So one point I would be interested in, I mean, we're talking about really heavy and serious topics. We're talking of people losing their lives in thousands. We're talking about, I mean, the salty taste of child marriage and trafficking going up, which is unfortunately also happening in other countries. So, I mean, it is always the question, how can we report on these serious topics, and how can we go on to cover these topics? Because of course also editors at some point are saying, okay, we need to have something in between, or they might say, oh, there was again a cyclone. We had reported about a cyclone last year or half a year ago. So what are your approaches to go on with these topics, which are not always easy to consume? I mean, also for yourselves, easy to consume. So, Martina, Fabea, who wants?
Well, for me, that's a very difficult question, because I'm not too satisfied with our publishers' behaviors in terms of selecting topics. I became very frustrated over the past 10 years in observing how the big publishing houses are choosing topics which they seem to be important for the public. What that means is climate change and health for the longest time had been completely neglected, as you already said, Natalie, in the very beginning. So in order to sell a topic on climate change and health, you really have to be lucky. Now, this year, finally, climate change and health has reached the global, not only the global, but also in Germany, the national agenda. Just yesterday, there was a policy brief about the Lancet Countdown report, and all the major organizations here in Germany, like the Chamber of Medical Doctors and others, they finally agreed that climate change and health has to do with one another. So let's hope that now, after the publication of this latest report, and after finally institutions in Germany have recognized global climate change and health as a topic, let's hope that now we can better sell our topics. But there's no advice on how to sell them. I mean, other than keeping on underlining that this is really an important topic again and again and again. And then it depends on your own luck, in my opinion, if someone decides to publish the story and not. And of course, in cooperation with a good photographer like Fabea, it for sure is much easier to sell a topic. That's my experience. If you just go out yourself, and we print journalists or journalists in general, we are not photographers. We cannot take such a good picture as Fabea, for example. This is something you have to learn, and I strongly believe in qualification and specification. So the cooperation between a journalist and a photographer, in my opinion, is very crucial for selling a topic to the media.
And Fabea, I mean, we saw you really until the top in water. I mean, how many times do you need to motivate yourself to say, okay, today I will go swimming again with my camera? I mean, it also takes effort to do these stories and then to get it published and commissioned.
As Martina shared, that of course this is a topic that no editor is willing to hear, just from my experience too. Like every time I write about flood, like again flood, are you going to go to the flood news again? I mean, why not? Because if you see that even last year we have had 4 cyclones. I mean, it's not December, but we had 4 cyclones and several months of flooding. So situation is changing of course, we need to give a greater, nice, good point to our editors, like we need to connect health issues, we need to connect international angle with the stories, but these are the human suffering is so visible that we cannot deny. And of course, this is a plus point for me, because I can write and do photograph, and I also make some short film documentary. So together, all these things like multimedia piece is more, I mean, you can sell it to the editor easily than only just because nowadays the editors are not ready to give a lot of fund, because they are not ready to give you fund for local fix, transportation, and other criteria. So and of course, as you were asking me, this is dangerous, it's not easy. And as you all know, as a female visual journalist working in Bangladesh or in India or in Pakistan, it's not easy, because when a cyclone is, because during this cyclone Bulbul, I was on the road and the cyclone was approaching to us. I was on the car with only my driver that I heard for the work. So it is not easy. It is frightening, but to me, the great motivation is that there are families, there are children, there are pregnant women who are facing it every day. They do not have anywhere to go, because in the cyclone center, you will see thousands and thousands of people there. You cannot just step inside. It's so packed. If they can survive, if they can experience these things and survive, why we cannot report about it? So yeah, that's true that it is difficult and it is dangerous. I have to think about my safety as well, and carrying all these gears. And we do not have electricity during the time of floods or cyclone. There is no internet. My family doesn't know where I am, like where I am working. So it is difficult in that sense. But I believe that our passion for storytelling and our commitment for storytelling is what actually drive us to report this kind of incident. Yeah, thank you.
When we're talking about this issue, I mean, we have no special situation. I mean, since 8 months, Corona is a daily topic. We need to think about it. I mean, it is not as easy as it was before anymore to go out and report. It doesn't matter if you're in Germany or if you're in Bangladesh, India, or in the Philippines, but nevertheless, there are some other reasons. And I mean, this is also, I think, one point we all need to think about twice. And it's easy for the editor to say, hey, can you go to Dharavi, make a reportage? And so like, wait, it is not so easy. It's the same to ask you for beer, can you just go to the biggest slum of Dhaka and make a nice reportage? I mean, it also takes a lot of arguments why you can't do it or how you need to do it differently. And I guess this is something we were all working the last 8 months. I think no one of us just stopped at this one point where we have a lot of discussions about it. But for you both, I mean, how did the work change due to Corona?
May I? Yeah, first, okay. So for me, nothing changed basically, because from the day one, I'm working in the field. Like, as I told you, as I shared in my slide, that only a very few female photojournalists or even journalists are working in the field, especially in the remote places or in the Rohingya camp or in the other places like Sundarban. So I feel like I feel a different kind of responsibility, because I have to go there and work. Of course, it was very frightening. Like, I mean, so many safety precautions. I can remember myself like wearing, I mean, hazmat suit all the time and cleaning my hands. Every second is frightening, of course. But I believe that because of this crisis, what I have learned that because everything was like so certain, we can predict about so many stories and so many things, but in a very short period of time, we lost that certainty and we enter into an emergency that we realize that no one is safe, everyone is connected. That is my one realization, that no matter how hard it seems, we all are connected and we all are suffering. It's kind of a butterfly effect that we all are facing. So I believe for me, it has changed me a lot, and my reporting style, my photography style, everything has changed.
And Martina, what has changed for you?
It has changed on different levels. When the pandemic started, I was working in Manila altogether for 3 months. And in Manila, the people started to behave differently at a much earlier stage than in Germany, for example. And everything was just shutting down immediately. Schools were closed, shops were closed, there was no public transportation anymore. There were several bans in different areas, and the entire atmosphere became really aggressive. And as you might know, the policy or the policy style in a country like the Philippines is very different from the style in some other countries. So it got completely totalitarian, and the only thing you could do as a journalist is try to leave this country as soon as possible. And I was actually catching one of the last international flights to go back to Germany prior to my scheduled flight end of March. And I have to say, I was lucky that I could leave the country, even though from a journalistic point of view, of course, you always like to be, like Fabea said, in the center of, of action. But in that specific situation, I wanted to go home because there was nothing much you could do anymore. So this was the first tremendous change. And then the second change I realized is that from one day to the other, there was no other interest anymore than reporting on COVID-19. It was like the world has stopped to think about other relevant health topics and topics in general, but also health topics. I tried to sell some other stories from the Philippines, and it was just all about COVID-19. No other topic was relevant anymore. And that, to me, is kind of frustrating because the world goes on. There are so many other pressing health issues. For example, climate change and health. For example, rise of mental diseases. For example, aging population and lack of infrastructure. For example, rise of neglected tropical diseases. I mean, the list is so long, lack of universal health coverage and so many other things. No one was interested anymore other than COVID-19. And I absolutely believe that it's important to cover the pandemic as seriously as possible. But in many countries, other topics are pressing too. So that has changed for me and in general from a journalistic perspective. And number three is, my entire work has changed. I cannot work in the field anymore because most of the countries I was planning to work in are closed. It will take ages to get a journalistic visa. You're taking a great risk. So everything has to be done online now. So lectures are given online. Maybe it's here in Germany, it's a little bit different than for you, Natalie, working in the field, being in Mumbai already. But if you used to work on and off in other countries, I think the situation has changed a lot.
I mean, the thing is, like, it took me also time to come to Germany to have a little break because of the situation. That's why I'm greeting you here from Bavaria. But yeah, I mean, I see 2 points. And on the one side, COVID has overtaken a lot. So at the beginning, no one was interested in stories from India because there was no COVID emergency in India. When the numbers were rising in India, I got a lot of attention. But I mean, of course, also in India, I needed to figure out, like the other colleagues, which are also here in the chat, we needed to figure out how we can do things safely and how it is possible. So, I mean, I also did not went to every slum because, I mean, in the situation, you need to think twice, is it worth now, or can you cooperate with someone? We have some questions from the audience, but I would first ask you one other question, and then we can talk about framing and also how maybe to develop some ideas. So because at the end, I also had the feeling, so Corona was a bit over, so now I just did a story on tuberculosis, because of course other issues are also there. And I mean, this is a kind of a thing where you can guess or try to get a feeling. So when Germany has enough Corona topics already, and when they may be open for another topic, because I also did a health research on leprosy, and then they said, oh, we have so much corona, we can't take this topic now also, and does it really exist anymore? They said like, yes, it existing. So I connect one question, which is I think for everybody of us interesting and worth to talk about it, and then we have a look at the questions from the round. I'm interested in how to report safely for yourself and also for the protagonist, for the interviewees, because if I imagine I go to women who had operation or to if you report on child trafficking, which is now rising, or if you report on domestic violence. I mean, you also need to find a way to protect yourself and to protect the protagonist, because not everybody will be happy if you touch these topics. So of course, there's something like a risk assessment. Most of us heard about it or need to do it already with their editors. So, but Martina told me that she's preparing half a year for her stories. Also for Bea told me that she has a special process. Maybe you can give a short example, like how you're doing it at the moment. And yeah, I mean, what kind of measure, because these are sensitive topics. You can say it is just health, but I mean, if you say it's just health, I mean, in some countries it's really can be a topic, because you need to have a look, what is the strategy? I mean, there are countries which are saying, yes, we have health problems, so please, international organization, help us. And there are other countries who are likely to play it down because they say we don't need so much foreign aid and we don't need foreign reporters to tell us where are we lacking. I mean, it depends from country to country and from state to state, but I mean, these are all things I guess we have experienced already working in the field.
Fabia, you want to start? Or?
Yeah, sure. So as you shared that, this is a really nice question. So yes, of course, we are responsible when we are reporting. Not only we have to consider our safety, but also protagonist safety as well. For an example, I did a lot of stories on gender-based violence, sexual harassment, and domestic violence. For many of the stories, I didn't show their faces, because you can tell a story in many different ways. You don't have to show survivor's face. I was very, very certain about that I'm not going to do it. Sometimes editor like, hey, you have to, otherwise the audience, and I changed their name. So what I did, I always video recorded the interview. I have my signed consent from them. And I also have some pictures that I didn't publish just for the editors. So we have to have that as well. So that was my one point when I'm covering sensitive topics, because I always, like, it's been many years, like 10 years and more, that I'm reporting on textile industry. And this is a very sensitive space, like for me and the workers as well. So, and also, even when we are reporting from the rural parts of Bangladesh, coastal belt of Bangladesh, contraceptives is not available. Abortion is taking place, and there, even in Rohingya refugee camp, abortion is taking place. But we have to report it very sensitively without telling their names and showing their face and what is happening there. So these are something that we should always consider. And for reporting this kind of sensitive issues, we have to, I basically do a lot of research and I prepare myself. It's like, it's been 2 years that now I'm very concerned about my safety. Honestly, I was never very, I never thought about my safety before that, because many incidents had happened in past 2 years, and I realized that how important safety trainings are. This year I took part in all the safety trainings that I was I got into. So I did safety trainings under the Silk Road. It was ECOS Alliance funded training program. So I believe that as a journalist, we must take those trainings for our safety and to do better reporting. Yeah, Martina, so now you can share about your.
Yeah. Yes, most of the research trips I've conducted were prepared for quite some months in order to be safe while working on the field. That means I try to reach out to as many people as possible, local NGOs, local doctors, midwives, patients who were recommended to meet and openly to talk, and so on and so forth. And I tried not to rely on international organizations so much, because I think that their agenda is completely different. They all have a hidden agenda, and this is opposite of my agenda as a journalist. So I try to stick to local people and mostly local NGOs in order to be safe. And with the help of local NGOs, I'm trying to get in touch with patients who got affected by a specific issue. For example, when working in Pakistan, I tried to reach out to a local NGO, which was recommended to me as a reliable NGO, and they again brought me in touch with families who have children with genetic disorders, and it's very complicated to talk to those patients, and of course they don't want to talk, and the families don't want to talk, and in order to get into their houses and to be safe and to be covered up entirely, because it's a Muslim country, you have to have someone who is behind you, who is on your side, and you need several fixtures and so on and so forth. So that takes time. And in other countries, like for example, when I worked in Nigeria, close to the Boko Haram, it was really, I was in the end not safe enough. Even though this research had been prepared for quite some time, I felt like I'm taking a risk which is too high. So there are risks which can't be avoided completely, and then it's your own choice if you want to go for it, for the story, or no. And this was a situation in which I personally regretted that I took the risk, because it's not worth the risk in the end. You want to go home after all. But I think for a normal research with a medium risk involved, it should be good enough if you reach out to local people and you know that these local people can be trusted, and then you should be on the safe side. And of course, I also took some of this risk trainings when I worked as a consultant for ADB and other organizations. You can do this risk trainings. But personally, sometimes I think asking your own, to listen to your own gut feeling is the best thing you can do in a specific situation. And despite all these trainings, in the end, you know yourself when the situation is getting too risky, and no one else. So, yeah.
So Martina was now giving an example when she reported about health. So Sonia had the question, like, we had already seminars before talking about climate change, but how can we add more health? I think in your case, Martina, you're covering mostly health.
Only health.
Only health. So maybe the question more to Fabea, and then there was the question about how can we find a way to frame it to underline climate crisis and health issues. We both said it's tricky, but I think there can be ways to reach out and to find also not only this alarming way how NGOs are doing it, but maybe with the human interest to find a way. Well, I open it for the discussion with you. So maybe Fabea, in your reporting, how can you add more health?
Yeah. So wait, it was more like how to pitch it, like how media is reacting, because Martina started in telling us that we have to do more reporting on, it's not about you as a journalist, but how can reporting change? Because we had this discussion that even reporting on climate crisis is still not really going on. It's changing a little bit, maybe. But how can you add now, if you say it's really urgent to add the health issue, how can we move media houses to get the point? It was not about our personal reporting, but how can there be a change in their thinking? Because it's even difficult with reporting on climate crisis.
Honestly, to answer your question, what I was thinking when Germany was hit by the COVID-19 pandemic, I thought, finally, this arrogant country is waking up. Because for the longest time, global health issues were not of any interest to anybody. Because why? Because no one was really affected. So, and to answer your question, and now everybody is affected, and to answer your question, I think in order to get people attracted to this very important topic, you have to report about a situation which is happening here in Germany. Let's say that a certain disease is now finally has reached Germany because of climate change. We have more mosquitoes, we have longer transmission seasons, we have elderly people dying because of exposed heat. This is happening in our country too. And then you can try to bridge the gap from Germany to another country and say what is happening here already on a rather small scale, but it's happening already, happens in low and middle income countries around the world to a much larger extent. And then you have the interest of the reader, who's mostly only interested in his own neighborhood. You have the interest of the reader on the specific important issue, and at the same time, you make the reader interested that this issue is going on around the world already, or has been going on for a rather long time.
Or maybe also to find a way where there's already expertise, because I did a story on malaria and dengue prevention in Mumbai. I mean, of course, the conditions are totally different, but maybe you can see if there's a transfer to learn. Mm-hmm. Because countries like, I mean, my neighbors say, oh, it was just dengue. And I mean, if a German person gets dengue or cases are in Germany, it's really a big issue.
I had dengue once, it's terrible. Well.
So, Priti, if you want, you can ask your question directly, if it's still current. Okay, then
can you hear me? Can you hear me?
Yes, we can hear you.
Okay. Yeah, so I just want to know how you find ideas that are related, I mean, that are linked both to climate change and health.
How we find ideas?
Yes, how you find ideas.
For me personally, I'm reading a lot, also because I also do scientific work. So you get a first idea about what is going on, and then of course, if you work on the ground in the countries, you see what's going on. I mean, look at typhoon seasons. For example, in the Philippines, I've experienced also, like Fabea said, so many typhoons, and you are wondering, why are there so many? And then you get exposed to this specific thing. Or you see how people in congested cities, for example, when I worked in Chennai, I was shocked about the air pollution or the quality of the air. And you realize that something is changing and that this is a topic which is important to talk about. So it's a combination of reading and experiencing what's going on.
And Fabea, for you, can you still see the topics if you see it every day? I mean, the air pollution in India, it's non-stop there. Similar in Dhaka, you still see the issues?
Like in Bangladesh, I think everyone once in a lifetime have had malaria and all kinds of fevers. So yes, it's a good question, because that is what we always ask when we are in the field. As Martina said, for me, it is always when I'm working in the field, for a particular, like we are reporting for for another story, but you are going to get insight from the field and you have to ask a lot of questions. What works for me? For an example, when I was in the coastal belt, when I was investigating child marriage, then I got to know that how young girls are having their period when they hit 9 years old or 10 years old. This is not the case in other parts of Bangladesh. It is always like at least 13, 14. So that so this is how, when you interview someone and get to know the locals, and you need to always read various resources, publications, and scientific data, and as well as you need to have that good contact from the place where you will be reporting. I believe that you can connect all this together with the climate change and health. And of course, these all are interconnected, like economy, health, and of course the family. So everything is connected with health and climate change. And for Bangladesh, I mean, every story is a climate change story. Everything. For an example, like now fishermen are not getting enough fish, so that's a climate change story. Migration, huge migration. People are coming to in Dhaka city. We have 20 million people, and 7 million people are living in slum. So they do not have any healthcare facilities. I mean, and this is linked with the climate change, because the people who are displaced, they lost their homes because of river erosion. Island has been disappeared. So whenever you are doing this reporting or researching, you have to search for it and then connecting the dots. Like for an example, when someone is reporting on sex workers or prostitution, you will find so many girls in the brothel who come from the communities, those who are badly affected by cyclone, flooding, river erosion. So it's trafficking is also connected with climate change. So you can connect so many things. People in Bangladesh, people are living, same as for Philippines or India or Pakistan. People are working in the Gulf countries, in Saudi Arabia and Iran, Iraq, and everywhere. So this is also because of climate change. I believe this is how we will connect your story.
I would like to add some sentence to what Fabea just said. I think that was a very important point, the combination of trafficking and climate change. And then I want to share a reaction of one of German's editors. I wanted to do a story last year about climate change and trafficking. And the reaction of the editor was, not again, and that really has nothing to do with one another. There's either climate change or there's trafficking, but I cannot really see the point in combining these two issues. And that was really sad, because it is actually a pressing topic, and it is a reason because why women start working in this business. But yeah, some people still don't want to see.
Maybe he has not understood that push and pull factors are changing. I mean,
yeah,
because society is changing, these things are also changing. Lena had a question. So she would be interested in how easy, how difficult it is to talk to health workers, to doctors, and how hesitant are they to connect pneumonia, do I see, with the climate change? So I think it's about if you have the air pollution and to connect it to other issues.
No, phenomenon, I write. I just wanted to ask, like when you speak to doctors and they see certain phenomenon, health issues, are they hesitant to connect that with something with some climate change problems, or are they not? Because often scientists are very, when studies come, they say, oh yeah, we have to be very cautious to make these connections. And from my experience, health workers on the ground are much faster with it. And what's your experience on that? Thank you.
From my experience, it depends on the level of knowledge of the health worker. If you talk to a health worker in a local district of country XY, he might not be able to draw the connection between these issues. But if this health worker or doctor is well educated, yes, he will be open to talk about it, and he might already have come to the conclusion himself that it has to do with one another. Yeah.
I believe that we should reach to the expert from the field. Like in Bangladesh, whenever I'm looking for any kind of comment or information, so I always look into two kinds of consideration. Number one, who is always working in the field, so they have the practical experience that how many female or pregnant women are visiting their facility every day, and how many of them has interest removal operation in last 1 month. So they can give you this kind of data, but for an expert opinion, we should always rely on the expert on the field who has better research, and they can tell us about the crucial information that we need.
Thanks.
So we are officially over the time, but if the speakers and the audience want to join us for a few more minutes, I would say we can ask a few more questions. So it is up to you now. Would you be available, first of all, to our speakers?
Yeah.
Yes, I have that problem.
Okay. So audience, feel free to raise questions. I would have now one more question, so give the audience a bit time to think about it. In the introduction, we were talking about grants already, and most of the participants, we know each other because we joined a journalistic program. So, of course, it's an interesting question. If you report on health and on climate, you need time and you need a financing basis. So can be grants a door opener, or will it be the future? I mean, on the other hand side, we also see if we report with grants, I mean, there are limitations. And of course, there are special programs. So how do you see it for the future?
Well, I'm not too optimistic about the future of journalism, to be honest. Because my experience from the last 15 and more years is that without proper funding, proper journalism is not possible anymore. And depends on your expectations about your income, of course. In the beginning, when you start your career, you might be satisfied with a rather small amount of income. But the moment you are getting more experienced, you think that your stories and your work is worth being paid a little bit more. And there comes a point when you start asking why such a tremendous effort of work is not paid accordingly. And this is a question which has to be raised by the journalistic community more and more, in my opinion, because we are absolutely underpaid. And I think that grants are crucial, still very much crucial for the future of serious reporting. And I do not see any publishing house, including Spiegel, including the big journals. I mean, I've recently published for Lancet, for BMJ, Spiegel and others, and all of them are not willing to pay a single dollar for supporting your work in the field. They are not willing to. They expect you to come up with the finances, and then if you're lucky, they are going to accept your work. So, and this is, in my opinion, a very negative development. So without grants, I don't see much future.
But to say something positive, I'm really impressed by the work you have done so far, Martina. So I think you use your grants in a really good way. And for Bea too, I saw you're also really busy with using the opportunities which are open, which are up.
I can understand what Martina refers. I mean, this is very challenging profession. And I mean, no matter how much enthusiasm we have, our commitment, our honesty, our passion for storytelling, but at the end of the day, if we are not safe, we can't live at least a proper life, then actually what actually we are, it is not only for us at the end of the day. For example, like as a photojournalist, the startup cost is like $10,000. Like if almost every year I'm upgrading my gears, it's a huge financial burden. And no matter like it's done, Spiegel, New York Times, Guardian, I have worked for so many major international outlets, but I mean, it is very sad that we are not getting paid what we need to continue this journey, because I mean, it is evident that journalistic work, proper journalistic work is needed in the society. So it is, of course, but I truly believe, I don't lose hope, because I see grant is a great opportunity. Like 1 month ago, I received a grant from Population Reference Bureau for doing health reporting. And it is I'm very grateful that still we have some opportunities open for us, but it is very limited. And if you consider the number of competition between all of us for getting that grant, and if you see that there is a lot of internal networking, and as a woman of color, I feel like I have so many barriers. Respect to all of you, but still I feel like there is a certain barrier that I have to prove myself in various ways. So I get disheartened. I feel sad because I have applied for like 10, 20 grants in the last couple of months, but see what I got, like 1, 2, 3 in the entire career so far now. So it is heartening, but I believe that if we continue to do what we are doing, and like I used to believe that we have to be very when we are applying for grants, we have to be like this and that. It has to be so perfect. But from my experience, like when I least put effort, I got those grants because I was very genuine. Like I didn't even check my grammar and everything, but I gave a lot of interview. You know that there are a lot of interview happen, like filtering process. But that time I realized that if we care for the topic and we love the topic and we continue to apply for the grant, we actually got it. So I believe that we should continue applying and find what actually we love. Otherwise, we will give up, because this profession is not for what I can say. Like it takes a lot from us. And if we say about the trauma that we all have with us while reporting these issues, it is massive.
So Sonia was mentioning it becomes a problem that the editors even think that you should organize everything. And I mean, yes, sometimes they want you to present a pitch, which sounds good. You have the protagonists already, everything fixed, but it's not so easy. Besides, you have been there and did the research already. So this is an unfortunate topic, but to gap it a little bit, and we had already one seminar just focusing on that, is probably the cross-border as a collaboration. And at the moment, it is sometimes also the only way, because there are certain restrictions in traveling. So Fabia, was this for you a good chance now to work together more with foreign publications during the pandemic? That your work is getting more highlighted?
Yes, of course, because I believe because of this pandemic, many of the editors I used to work realized that cross-border reporting can be a way. I did a lot of collaborative project, and even I'm applying collaboratively with my other colleagues. So I believe that this is also an opportunity where we can come together, because you know this travel ban, and so many of us cannot travel to different places. But if we can collaboratively work and apply for this grant or pitch to the editors, I believe this will happen. It's a good idea.
So we will have one last mini-meter, and then we will say to everybody goodbye. So if you once more want to let us know what you think, Petra is providing us a link now.
So please follow the link again in Mentimeter, and you can vote. And I will present. So. Aha. A clear, I think, outcome. I give back to Natalie.
So I think we can take out of it, we have the feeling it's underrepresented, and let's think about it, how we can push it a bit more. Thank you for the insights from Bangladesh, and also Martina did some really interesting work about the Philippines. So if you want to know more about their work, they have really lovely websites and articles about them written by them. So I really appreciated to go through your work, and I would say let's stay in touch. And we're also looking forward to, there will be 2 more seminars on reporting the climate crisis, and we will announce them soon to the network and also via email. So
Thank you so much, everyone.
Thank you very much.